data. Now, the thing about this BA.5 is that it is immune escape, meaning that people who have got other infections of Omicron are getting reinfected. People have got reinfected even within the same month after they've recovered from another Omicron infection in the past. So it is completely, it's a lot of immune escape. You're seeing a lot of immune escape, and we're also seeing a lot of the vaccination escape as well. So that means that you could be vaccinated and still get infected. But overall, the way the vaccination and prior infections work is that it's unlikely that you'll get as severely ill if you were if you didn't have that immunity, either be it from a vaccination or from prior infection or a more recent infection. I wouldn't say prior infection, but this is a kind of changing constantly. The Omicron variants are constantly modifying themselves. There is a vaccination that they're looking at changing, especially Moderna is looking at changing. It's called the bivalent vaccine, to look at how it can protect against Omicron as well, which is not currently available, but should be available by the end of the year. So that is something. The important thing to remember is if you have an elderly individual that you're caring for, or people are under your care, or there is it may be a relative or a family member or a friend who's elderly and who also has a medical condition, when they get infected with an Omicron or a BA.5, it is usually they recover. But what happens is that it makes their body more frail. It kind of wipes out the ability of the body to fight future infections. So what then happens is they get a secondary infection, like a pneumonia from a bacterial infection, or could be another viral infection, and they get a series of other infections, which then leads to significant health deterioration. And that is what we are seeing more recently, rather than the virus itself causing severe pneumonia, which still occurs. But the more important problem, or the more common problem we say, is the virus comes in, it gives a flu-like presentation with body ache, fever, cough, and makes them very tired, lasts about a little longer, about a week or so. If they don't take an antiviral medicine like Paxlovid, then it lasts about a week or longer. And then they recover, they get better. But then what happens is the body is so wiped out, the immune system is so wiped out from that Omicron virus that they are susceptible to other viral or bacterial infection. They may get a secondary pneumonia, or another get really sick, which is then leading to hospitalization. So it's so important that even though it's not a direct effect, it still takes it takes everything out of medically frail individuals or elderly. So you still have to be very careful when somebody has an infection, to really avoid contact with elderly individuals or those who are much more prone to get sick. And that could be a good number of our patients and the residents in the DD community. So just to bear that in mind. Now, a word about Paxlovid. Paxlovid is a medication that is an antiviral medication. If taken within 3 days of the onset of symptoms, it decreases the severity of the infection. So, for example, I've had other friends who have become positive with BA.5 recently, and the persons who have taken the Paxlovid by day 2 or day 3 felt like the next day they really felt like they didn't even, the body ache was gone, the fever was gone, and they felt much better. So they're recovering much quicker after taking Paxlovid. But if it's given, it should be given within 3 days. Paxlovid is very commonly available. You just have to call your primary care physician, and they can call it into your pharmacy, and they should be able to get it. So anybody, it is a tablet form. You have to take it twice a day, and it's a 5-day course. So I would say, if you don't want to really get, because the BA.5 is making people really like flu-like, the body ache, severe body ache and severe fever is being more common. So if you want to really cut short, cut short the symptoms of even BA.5, you could call in your doctor even after you test positive in a home kit. Just say, I would like I've tested positive, I would like some Paxlovid, and then you have to give the list of medications you're on, because there are some medications with which Paxlovid cannot be given. So you have to let the doctor know what medications you're taking, and if there is no contraindication, then taking the Paxlovid is a good idea to cut short. The biggest issue that we are seeing with the Omicron and other variants is that long COVID. People, whether it was, even if you have a milder infection, there are still individuals who are still experiencing fatigue, loss of taste, a lingering cough, the tiredness, and kind of not really back to their full form for anywhere from 3 months to 6 months post infection. That's part of the long COVID. That's all I have. Anybody else have any questions I can answer? Heike, any questions?
I do not see any questions in the chat box.
All right. Thank you all.
Thank you. Thanks, Dr. Stanislaus. Hey, everybody. This is Jess Bex. Happy Friday to you. Just a few updates to provide, and I'm going to share my screen. Heike, if you wouldn't mind passing me the ball. Want to tell you about a few things that we have going on that are new or maybe new to you. And looks like I've got my ability to share. Okay. So you should be seeing the, there we go, information. Heike, are you seeing the information about mission, vision, and values?
Yes.
Awesome. Okay. So there is information on our website. BMH recently released our new 5-year strategic plan, and that included our new mission, vision, and values. We encourage everybody to go out there and take a look. It is really reflective of the updates of where we are at today. So we put in a lot of time making sure that we were encompassing where the department was heading, and so our mission, it has updated to serving, empowering, and supporting Missourians to live their best lives. And the vision for that is Missourians are safe, valued, and supported community members. And then our core values as a department include accountability, collaboration, empathy, excellence, inclusion, innovation, responsiveness, and transparency. That does not mean those are our only values, but those are the ones that we chose that really were at the core of what was most important to us. We also chose guiding principles because we felt like there were some things that were very important to us that were really just not well communicated through those mission, vision, and values. So number one, safety is central to a person's physical, mental, and emotional well-being. Every person has value and should be respected. And evidence-based practices are key to success, and data and performance will drive decisions. So we really want these to be the guiding principles in all of the work that we are doing. And we have a video out there where you can watch the new strategic directions video. And then we also have a full document if you'd like to read more about the 5-year plan and updated information about the services that we offer. I don't think it's a surprise to anyone that when you look at the 8 buckets of strategic directions that we have, that workforce is the number one. But in those kind of 8 buckets, it also includes mental well-being, technology, both on the individual level and the system level, quality outcomes, expanding capacity and infrastructure, children's services and supports, independence and self-sufficiency, and operational excellence. Again, just getting back to that, making sure that all of our decisions are based on data and that we are measuring the success of each of the initiatives that we have. So in addition to what's in here, we have a document that will be coming out soon that has a more detailed breakdown of each individual initiative, where we'll be able to show the progress of those. So that's coming soon. Also, what has happened since the last time we spoke is the rollout of 988 in Missouri and across the nation. So in July, 988 became the national 3-digit number to call with a need for mental health, substance use, and suicide crises. And so anyone who is needing support can now just dial that 3-digit number, and it is routed to the 24/7 hub that is available. So there's a lot of information out here about 988 and how it works. I think one of my favorites is the 988 one-pager, where you can see the kind of process map of how the crisis services works in Missouri, and how it will work with 988. So I encourage everyone to go out there and check that out for more information, and make sure that everyone is available, that 988 is a resource for all Missourians, including those with developmental disabilities and their family members and support systems. One of the things we're really excited about is the rollout of our provider notice portal. We want to get much more streamlined with our communication efforts, and not rely so much on phone calls, emails, and the things that can get lost, and you may not know if someone's seen them, and we may play phone tag and time consuming. So our provider notice portal is the first attack in that effort. And when you click on that provider notice portal, it gives you information about exactly what that is for. And it is for the 30-day notice to be provided. And this is allows the provider to communicate that 30-day notice through the portal, and that meets the requirements of the section 3.3.5 of the contract. So make sure and check that out if you have not seen it. And then also wanted to talk about the department's focus on MIDD efforts, and as a part of that, we are doing Mental Health Mondays on our DD side in our communication and our email blast, and on the behavioral health side in their communication weekly, they are doing Thursday Thoughts on IDD. So that's just one piece. So we'll communicate through that the initiatives that we are doing to progress in better collaboration and new models of care, and to better take care of that population. So you can get those come through the email blast, but you can also get to those by going to our DD site and then to the director's office page, and you'll see a Mental Health Mondays button. And then you can see each week there is information that goes out about supporting the behavioral health of the individuals that we serve. Quick update on Connection. I wanted to let everyone know that we are at the point where, go here and show you status, we are 77% complete and moving right along. So we are really at the in the end of design and build and configuration, and moving straight into testing, which is very exciting. We're also working to get the training resources rolled out and put together, and so we'll have a training plan to communicate very soon. So thanks to everyone who's been partnering and working on that. We also have a couple of webinars that are coming up that I want to make sure that everyone is aware of, and that is, I'll get to you for your email blast. So we do have our Tiered Support Summit that is upcoming for professionals. That's July 27th and 28th. So if that is one of the value-based payment incentives you were interested in as an ISL provider, or if you're interested in that, we are looking to collect data on a future value-based payment for implementation of tiered supports at other provider types. So I encourage you to learn more about tiered supports if you're able to attend that summit. There will be recordings afterwards and information available from the summit. The other one that I want to call attention to is our value-based payment stakeholder session. And those are, we had our first one for service providers on July 18th. And then we have one for targeted case managers on July 25th, and for individuals, families, and guardians on August 8th. You can see the recording. I think the recording will be posted very soon for the one for service providers if it has not already been posted. So I'm going to stop sharing right now, and couple more updates. One is that we have gained a new children's director for the Department of Mental Health, and that is Clay Stearns. So many of you are familiar with him because he is currently the Assistant Division Director for DD in the western side of the state, and he will has moved over to be the Children's Director for Department of Mental Health. So we are currently in the process of filling his role as the Western ADD, and we'll communicate when we've hired his replacement for that role. Last update is we received a great response to the RFI that was put out for the case management privatization budget item, and so there was a great response that will cover the need that we have to support that caseload being shifted from state support coordinators to private TCMs, and so we should have information going out about that either late this month or in the very early part of August. You can expect more information on that. And that is all of the updates that I had. Just any questions that came through, Heike?
If I can get off of mute, I can share that. I do know that one person asked to be walked through to get to some of those pages. So if there was something that we did not get you walked through to get to, you are more than welcome to reach out to me directly, or I can follow up with you and help you navigate the different pages on the website. And then there was a question that came in about the case management TCM providers increase, as well as the county status map. So don't know which one you would like to address first.
Sure. The rate increases for services, Angie is going to talk about next, so I'll leave that one for her. And the other one is the county status map, and that is the map should be updated. We have moved to in-person monitoring. That return to in-person monitoring has been in place, and so we will get that map updated. So I appreciate you calling our attention to that. All right, and I will turn it over to Angie for her update.
Hey, good morning, everyone. Let me see if I can get my we did want to remind everyone that we have new rates effective July 1st. However, Center for Medicare and Medicaid Services, CMS, they have to approve any of our rate methodology changes prior to us implementing those rate increases. So we had a handful of rates that changed the rate methodology based off of our rate studies, and then a handful, I'm stopping my camera because it's not working, and then a handful that were not that are not changing the rate methodology. So those rate services that are not changing rate methodology, and we have updated them in Seymour, are group home nursing, ISL nursing, rehabilitation, applied behavior analysis, the employment services, intensive therapeutic residential, and then our hospital support services. So those have been updated in Seymour as of July 1st. The remainder of our waiver services will need to continue to bill at your current rate until CMS approval is received. And then once we receive that CMS approval, we'll implement the new rate, we'll process any voids and rebills, but we'll also work closely with providers to make sure that communication goes out about how that's going to roll out and the time frame of those. So very similar to what we did last year. A common question that I'm getting is, when do we expect the CMS approval? It is so hard to tell. So I am going to just say let's plan on it like they did last year. I think our approval was towards the end of September, and we were able to start implementing those in October. We have had a couple of phone calls with CMS, and we do know that they have some questions for us they'll be sending us, and so as soon as we get those, we will respond as quickly as possible. As far as the rate increases that we have implemented into Seymour already, we do want to point out that after running one of our most recent batches of ISL updates, we did find that there were some issues with rates as they're related to the RAS scores. So our team has identified those, and they are working to address those discrepancies, and regional business offices are updating those as quick as they can, but we're pretty confident that not all of those issues that we ran into will be completed prior to the July 31st billings. So again, we're working diligently to get those done, but we are also asking that if providers go in and review their individuals, and if you notice a discrepancy, please reach out to your provider relation lead or to Maddie Starnes, our statewide business office lead, and they can check those to make sure those discrepancies are included in that larger fix, just to make sure we capture everything. So we appreciate that, and just again appreciate the patience everyone has. So then we also have, as we get the CMS approval for our rate methodology changes, and we'll be able to move forward with implementing rate increases, provider relations will be doing a WebEx just to review the changes to the shared living rate structure that will be implemented. So just want that to kind of be on everyone's radar to anticipate seeing that and participating in that WebEx. At the same time as we are implementing all of these rate increases, we are working with Mercer on the rate study refresh, so that is underway. We've been working on updating the wage data and anticipate information for providers to be ready mid-August. So while the rate increases for this state fiscal year that were approved by the General Assembly were for waiver services, we will be including in our rate study refresh waiver services as well as the targeted case management service. So kind of to that question earlier, we were not funded a rate increase for targeted case management for July 1st, but we are including them in the rate study refresh and updating that wage data and any assumptions that we made on the most recent rate study. Let me see here. And then, just so everyone kind of knows, that we have received our budget instructions. So our team is beginning our long days of the budget preparation. So we'll be pulling a lot of data here and just pulling that information together and working closely with our department's budget team as well as budget and planning for the administration. So lots going on in our camp this year, or this next few weeks, and I'm glancing through some of the questions to see if there's any more I can answer. Which group is self-directed services in for the rate increases? So for those that were implemented July 1st, self-directed services are PA, support broker, and community specialist. Those would be as part of the new CMS, like those that are needing CMS approval. Not all of those are receiving rate increases, though. With the rate study, there were some that would show a decrease. And what we're doing right now, because of our maintenance of effort and the fact that we're going through rate study refresh, we're not decreasing anyone's rates. If it looked like there was a rate decrease, then we are holding them constant where they're at, and we'll be analyzing again through the rate study refresh. So again, for self-directed services, those are part of PA, community specialist, and support broker, but it's going to depend on where that rate study fell out and what was funded by the General Assembly as to whether or not there's that increase or if we're holding them constant. Any other questions? Okay, if not, I'm going to hand it off to Emily so she can talk waivers. Thank you.
Thanks, Angie. Hi, this is Emily, and I'm the director of the Federal Programs Unit. And I was just going to give a quick update. You might have heard already that the federal COVID PHE has been extended. The current expiration date now will be October 13th. Yes, October 13th of this year. Then we'll see if they extend it past then for another 90 days. But at this time, it's October 13th, and that would mean as of now, any flexibilities will continue through that date. Your 1135 flexibilities will be effective until the end of the PHE, and all of the Appendix K flexibilities are effective until 6 months after the PHE ends. I think that's the only update I have for the waivers right now, other than we do have, Angie mentioned, we have the amendment out to CMS right now for the rate increases, the rate methodology, and the addition of the health assessment and coordination service, which is also known as the Station MD service. We'll be adding that to our waivers because right now it's currently part of an Appendix K flexibility. And then we are also, you may have seen some emails about informal public comment for our waiver renewals that are our Partnership for Hope and MoKids waiver renewals. Those are due July 1st of 2023. That's when they expire, so that's when we will be extending them. We're already in the process of reviewing changes for those waivers and then amendments to make them match the comp and CSW amendments to make them match the Partnership for Hope. And then we're also working on VBP amendments currently. So you'll be seeing more about that as well as we move along in the process of the VBP amendment. Some stakeholder sessions have been scheduled if you haven't been a part of those already. That's all I have. I was going to hand it over to Denise. I'm not if she's on today, or Jess, did you have? I'm going to hand it over to. Jess, I think you're on mute.
Of course. The double mute strikes again. Denise is on, so I'm going to turn it over to her in just a second. But I did see a question that came in regarding individuals who might be at their maximum funding with the rate increases that are coming in. And so those are handled on an individual basis, and that individual may need to move up into a different waiver, depending on if we are also processing an increase to the waiver maximum for that's related to the rate. So it's dependent upon the waiver. So, for example, Partnership for Hope, the maximum is not increasing, but with community support, I'm thinking, Emily, you can give me a nod, but I'm thinking we increased that one to correlate with the rate increases. Is that right?
Yeah, it is. I think that one actually is, that rate increase, or that's in a different amendment though. Oh yeah, waiver amendment cap for the CSW is increasing with our rate increase. You're right. Yeah. That is increasing. Yeah, CSW will be increasing to $40,000 if approved by CMS.
Yeah. So we'll wait for those and just handle that on an individual level basis. We may have some individuals who are in the partnership for Hope Waiver who may need to move up into the community support waiver, and then we'll help work through that process for everyone. So we don't want the rate increases that are intended to provide more access, preventing access. So appreciate that. Great question. And I will turn it over to Denise.
Thank you. Can you guys hear me okay?
Yep, I can hear you.
Okay, perfect. Thank you. Good morning, everyone. I wanted to take some time to share with
Denise,
you exciting.
hey, you are cutting out. I don't know if it's just me. I can hear you, but you're cutting out.
Yeah, it's very choppy.
Hey, I don't know how to fix that.
Now you sound okay. I don't know.
Sound good? Okay, well, I'll just hopefully talk slow. So I wanted to take an opportunity today to talk to you guys about an exciting opportunity for our IDD communities related to oral health. The Missouri Coalition for Oral Health is working with Enable Dental, and it's in an effort to improve oral health for our individuals and our communities. Currently, Enable Dental is accepting 125 patients into their pilot program. And with this program, they hope to encourage our IDD individuals to utilize their Medicaid coverage and improve oral health for them across the Missouri state as a whole. Enable Dental is able and available to provide on-site mobile dental services, which is great and exciting. Their program goals include improving oral health outcomes, improving education, helping with cost reduction for services, and they also want to collect data for our individuals with intellectual and developmental disabilities. Some of the services they do provide include x-rays. They'll do exams and perform cleanings. They can do extractions, complete fillings for the individual. Currently, Enable Dental is serving the St. Louis County, Lincoln County, Warren and Jefferson counties, St. Charles, Franklin, Shelby, and Monroe counties. And again, it's a decreased cost. Medicaid providers are able to utilize, these services if they have Medicaid. They do have some bundle package pricing for preventative services as well. And there is a reduced treatment fee schedule. You do have to complete a consent form for the individual to be put into this program. And we will be sending out at the end of this meeting today, there will be an email blast that will come out with a flyer related to this information that I'm sharing and what to expect with teledentistry, kind of the steps that they go through, what to expect prior to the visit, what happens with the first visit, the assessment, the cleaning, how that happens, what to expect with the teledentistry examination, and it kind of gives a summary. And then for future visits, what to kind of expect. On this flyer, it also shares with you the website for Enable Dental, which is enabledental.com, a phone number to reach out for information. And there is also an email address, info@enabledental.com, that you would send your consent forms to once they're completed. And the consent form does kind of give you what to expect as well. It asks for demographical information on your individual and of course the insurance information and kind of a history, medical history as to what is going on with that individual, and maybe some medications they might be taking, like blood thinners, things like that are important. And then it gives an authorization and a release to be treated. It also includes a privacy policy consent and gives a lot of information on the back form. It's a 4-page consent form. So like I said, that information on this Enable Dental will be coming out to you guys in an email blast that will link you directly to the flyer that I'm talking about, and then also the consent form. And I can't see if there's any questions. Is there any questions that you can see, Heike?
One thing that we do need to remind folks of is that the family or caregiver can just make the phone call. It doesn't have to be in the waiver authorization before they can call and use the service. And then the other piece, someone did have a question that says, is this dental program available to children? There are very few dentists who accept Medicaid and very few who are trained to support children with IDD in rural areas.
I currently don't know if there's any kind of an age restriction. My suggestion would be to request more information related to that at that info email, which again is, let me pull it back up.
It's in the chat box. I put all that information in the chat box for folks. Yeah.
Thank you, Heike. Yeah, info@enableddental.com. You're welcome to reach out to them and ask those questions. I'm not aware of any age restrictions. It's just for individuals, though, that have intellectual and developmental disabilities. So, and it's funded through a grant. The Missouri Developmental Disability Council has a grant that's funding this, I believe.
We did have one other question. Amanda, you asked about areas in the state where this is available. They are listed on the flyer, and I put the link in the chat box, and Denise shared those. The counties currently served are St. Louis, Lincoln, Warren, Jefferson, St. Charles, Franklin, Shelby, and Monroe. But as you'll see in the email blast that's coming out, if the county that you live in is not currently being served, it's recommended that you go ahead and fill out that application and show interest, as they are looking for opportunities to possibly be able to expand.
This is Emily, and I just want to echo what Heike, what you mentioned, and Denise. I've also spoken. Leslie DeGroat and I are part of the work with the Dental Council, and then and I know they've reached out and mentioned that they've had difficulty getting individuals on board with the Enabled Dental program, and this is definitely one of those resources if it fits for your county, for your location. And I'm not sure on the age limit, if there's any age limit either at this point. I'm not familiar enough with the program, but it is something that it's very, with the trained background with developmental disabilities, that can be very effective and helpful for our population, and also lead to potentially more support for funding for dental services for our population. So,
yeah, thank you, Emily. It's definitely important information to get out. We definitely want to utilize and be a part of the 125 people that are being selected for this. So I would, get your consents filled out and get them all sent in, and hopefully we get several people that are involved in this. All right. If there are no more questions, I guess I will pass it back to Jess to wrap up.
I think Jess had to jump off for another commitment. Was wanting to see if there were, Heike, did you see any additional questions?
I think, Emily, this is Angie. Oh, sorry, Heike.
Oh, no, you're fine. We were probably going to mention the same thing. Go ahead, Angie.
Okay, yeah, there are a couple more questions that I did see. If that's okay, if I go ahead and address those. There is a question about the TCM rate study. And so I just want to provide a little more clarification on that. Our targeted case management service, we did a rate study with our actuaries and with the providers for a rate methodology for state fiscal year 21, and at that time we had also revised our state plan amendment to incorporate that new rate methodology. That was done, it went into effect state fiscal year 21, so we did that over calendar year 2020. So that is the rate study that we'll be updating this summer to bring all of that wage data and those assumptions up to date with more current data. CMS requires that rate studies are done at least one time every 5 years, but because of the things that are going on market wise with wages and workforce shortages, we wanted to go ahead and bump up that targeted case management rate study earlier than waiting for the 5-year period. So that is what that piece is. Someone also asked about the wait list, and we were notified this morning that our wait list on our website, the links weren't working right. So those have just, while we were on this call, those links have been updated. So the current wait lists are on our website again, and should be reporting it for in-home as well as residential. And I think those were the last. Did I catch the last bit of questions, Heike?
Thanks. Jess wanted us to mention Station MD. Just another reminder that Station MD, and I kind of hit on it as well with the health and assessment coordination service. It's, currently approved through Appendix K, but we are proposing it be added to our all of our waivers as an ongoing service. Just a reminder that it's there. Talk with talk with individuals about the service. And then she wanted to remind everyone that family or caregivers can just make the phone call. It does not have to be authorized before they call and use that service.
Okay. And I think that is probably it.
I don't see anything else.
All right, perfect. Thank you. Everyone have a wonderful, oh wait, one more thing to mention. There is the next statewide provider service and TCM provider meeting that will be hosted by Carrie Williams and Wanda Crocker on August 18th. So make sure to put that on your calendars. That's a big meeting with lots of great information. Okay. I think that's all now. Everyone have a wonderful weekend. Try to stay cool and hydrated. Thank you.